Look at your wrist. That sleek black band isn't a status symbol. It isn't a personal trainer. It is a parole ankle monitor that you paid $500 to wear. You think you bought a device to track your fitness? That is simply not the case. In reality, you bought a surveyor's beacon, one that broadcasts your biological vulnerabilities directly to the people who profit from your decline. You believe the data stays in your phone. You believe the health app is for you. But while you count steps, they're calculating your expiration date. The insurance conglomerates have pulled off the greatest heist in modern history. They tricked you into gathering the evidence they will use to deny your coverage. They don't want you healthy. They want you quantified. Welcome to Digital Ruins, excavating the hidden history of technology to clarify your world today. To understand why your heart rate is now a negotiation tactic, we have to go back, not to the release of the Apple Watch, not to the invention of the Fitbit. We need to go back to a quiet boardroom in 2018, where the concept of private biology was signed away with a fountain pen. The date is September 19, 2018. The location, Boston, Massachusetts. The villain, John Hancock Life Insurance, one of the oldest and most trusted names in American finance. For 156 years, life insurance was a simple bet. You paid a premium, they bet you wouldn't die. If you did, they paid. It was a static contract based on a physical exam you took once, maybe twice in your life. Then, Marion Harrison, the CEO of John Hancock, walked onto a stage and killed that model. She announced that John Hancock would stop underwriting traditional life insurance policies entirely. From that day forward, every single policy would be interactive. Interactive is corporate speak for surveillance. To get coverage, you had to hand over your data. You had to wear the tracker. If you hit your targets, your premiums stayed low. If you took the device off, or if your metrics slipped, the price of your survival went up. They sold it as a perks program, a free Fitbit, a discounted Apple Watch, a trivial $20 toy to buy access to your entire cardiovascular history. This wasn't a health initiative, it was a data coup. But John Hancock didn't invent the legal framework for this extortion. They just exploited a loophole dug 8 years earlier. How is this legal? How can a corporation financially penalize you for not running 3 miles a day? It's hidden in the Affordable Care Act of 2010, specifically Section 2705. While everyone was arguing about death panels and socialized medicine, lobbyists for the insurance industry quietly engineered Section 2705. This clause allows employers to vary health insurance premiums by up to 30% based on participation in wellness programs. That is the trick. It's not a fine, it's a loss discount. If the standard premium is $1,000, they raise it to $1,300, then offer you a $300 discount if you upload your sleep data. The math is identical to a penalty, but the marketing is positive. Technically, this operates through risk segmentation. In the old world, insurance was a risk pool. The healthy subsidize the sick. That is the point of insurance. But with wearables, the pool evaporates. The algorithm identifies the super prime bodies, the runners, the kale eaters, the sleep optimizers, and groups them together with low rates. Everyone else? You are left in a subprime biological bracket. If you have a desk job, if you have sleep apnea, if you are poor and cannot afford the time to walk 10,000 steps, you are flagged as high risk. You're not just paying for insurance, you're paying a lifestyle tax derived from a gadget on your wrist. And the metric they use? It's a lie too. The 10,000 steps benchmark wasn't created by doctors. It was created in 1965 by a Japanese company called Yamasa Clock to sell a pedometer. It was marketing. Now it's the metric that determines if you can afford chemotherapy. History doesn't repeat, but it rhymes. And this rhyme is loud. In 1911, an engineer named Frederick Taylor published The Principles of Scientific Management. Taylor was obsessed with efficiency. He walked into steel mills with a stopwatch and a clipboard. He timed every motion of the workers. Taylor treated humans like wet machinery. He stripped them of autonomy and turned them into biological cogs. He called it scientific management. The workers called it hell. Today, the stopwatch isn't in the hand of a foreman. It is strapped to your wrist. The scientific management has moved from the factory floor to your bedroom, your commute, and your weekend hike. Taylor wanted to maximize the output of pig iron per hour. United Healthcare wants to maximize the output of wellness per dollar. The philosophy is identical. If you cannot measure it, you cannot punish it. Taylorism didn't die. It just got a battery life and a Bluetooth connection. You are still the worker in the steel mill, only now the shift never ends. So what happens when the algorithm turns on you? Imagine this scenario. You've been a gold status member of your Vitality program for 3 years. You wear the watch, you get the discount. Then you slip in the shower and break your hip, or you develop a thyroid condition, or you simply get depressed and stop running for a month. The device sees everything. It sees the sedentary time spike. It sees the heart rate variability drop. It doesn't see suffering. It sees liability. Your premiums adjust in real time. Just when you're sickest, just when you're most vulnerable, the system detects your non-compliance and raises your rates. The discount vanishes exactly when you need it most. This effectively destroys the concept of privacy. You cannot lie to your insurance anymore. You cannot say, I exercise occasionally. They have the logs. In 2021, Google completed its acquisition of Fitbit for $2.1 billion. You think Google paid $2 billion for plastic wristbands? No. They paid for 28 million active users' health data to feed their AI. Your body is now a public ledger. If you have a high resting heart rate, maybe your car insurance goes up. Maybe your mortgage rate tweaks because your sleep patterns indicate instability. This is the quantified serfdom. This is not an accidental overreach. It is a desperate business model. The insurance industry is facing a crisis. People are living longer with expensive chronic diseases. They cannot make money by simply betting you won't die. They have to actively manage your behavior to protect their margins. They don't cure you, because a cured patient is a lost customer. They manage you. They want you in the Goldilocks zone, healthy enough to pay premiums for 40 years, but anxious enough to keep engaging with the app. The United Healthcare Motion program literally lets you walk off the cost of an Apple Watch. They buy you the handcuffs provided you promise to wear them. They are outsourcing the job of the actuary to you. You are doing the work of categorizing your own risk for free every single day. The solution is not to walk more. The solution is to take the watch off. Real health isn't a metric. It isn't a streak on a screen. It is the silent, private function of a biological system that owes nothing to a shareholder. When you measure yourself through their lens, you change your behavior to suit their profit margins. Reclaim your biology. Refuse the discount. Pay the full price if you must, but keep your data in your own blood, not on their servers. Privacy is the only luxury left in the 21st century. Do not sell it for a 15% discount on a policy that will drop you the moment you stumble. The technology breaks, but the history remains. Subscribe to Digital Ruins to understand the pattern.